Hi everybody, this is Dimitri, Sports Acupuncturist from Opo and Health and Vitality Center, and today we're going to go over a couple of tips on what we can do when we have plantar fasciitis. And usually plantar fasciitis is pain right under the foot. It's worse with the first couple of steps in the morning. It could prevent us from doing what we love, like running. It could flare up around training when you're training for like a marathon or a half or some kind of event. Maybe when we're changing shoes or changing our intensity of training. So we're going to go over a couple of things today that we tell our patients to do and that could help get you out of pain. So the first thing we're going to recommend, and we always give our plantar fasciitis patients, if you will, a mobility ball. So I usually tell patients first thing in the morning, as soon as they wake up, they roll on the ball like so. So we're going to put it down and we're going to just roll the bottom of the foot on the ball. Now, some physicians and some coaches might tell you to use a frozen bottle of water, but I prefer not to use ice actually when treating plantar fasciitis. I prefer to use just a mobility ball and massage the bottom of the foot just to loosen up that connective tissue, that fascia. So that's the first thing I recommend patients to do. Now the second thing, especially when you're training or if you know that you're going to walk around a lot that day, I also recommend applying some functional tape. So we just cut 2 strips this way. These are called eye strips. So what we do is you want to essentially cut the first strip right at the edge here, and we're going to put it right below where it hurts. So typically plantar fasciitis, we have pain right around here. So we're going to put it right above that slightly. We're going to peel back the tape without touching the adhesive. Now the whole time my toes are going to be pointed up towards my nose, and all I'm going to do is pull just a little bit of tension and then apply that right up on top of the area of pain and discomfort. Now notice the edge of the tape, there's no tension. We're just going to roll that right onto the foot. So that's one way we can put it. Now the other strip that we want to do is we want to cut it right in the middle this time. Again, not touching the tape. And the middle part of the tape is going to go right above the area of pain. So if I have pain right here, I'm going to stretch it all the way and I'm going to put it right on top of that area of pain and discomfort. Now, just like before, the edges don't get any tension, so we're just going to roll back the tape and just put it on our foot this way. Again, my toes are always pointed up. Take the paper off, and then just apply that with no tension on the tape. And then you could put your shoe on and you could go do your training, or if you're going to walk a lot that day, if you have people coming from out of town and you're going to do touristy stuff, this is a great thing to have. The other thing I would recommend is doing sports acupuncture, because not only is it effective on reducing the pain, it also addresses what caused the pain in the first place. A lot of times people have issues in the hips that could put more pressure on the bottom of the foot. Sometimes we might have imbalances in the legs that we want to address. Sometimes we might have a bone that might be out of place that again is putting a lot of pressure on the plantar fascia, causing pain. Sometimes people can have bunions that can cause and contribute to the plantar fasciitis. So we don't only want to address the area of pain and discomfort, we also want to address the area of dysfunction. And that's something that separates us. So if you have any more questions, feel free, you can comment below, and we'll see you soon.